How safe is your food supply? A project by Delaney Rice, a senior at Nackwick High School. Project was due May 20th, 2017, on foodborne illness. The bacteria Clostridium perfringens has most likely caused a woman's death after eating at a Nackwick area community supper in December of 2014. New Brunswick's acting chief medical officer of health said, roughly 100 people attended the community supper in 2014, where a traditional holiday meal of turkey, vegetables, gravy, and pies were served. Dr. Jennifer Russell, the acting chief medical officer of health, said Clostridium perfringens is likely the cause of death of the woman in the Nackwick area. Within a few hours of the supper, several people became sick. One woman died, and 30 other people reported signs of gastrointestinal illness, diarrhea, and abdominal pain. Alex Hoffman, a Nackwick resident, and his wife were among those who had fell ill after eating the tainted food. He said, "At 2 o'clock we both woke up with a terrible bellyache, and then had to go that night 3 times." Alex Hoffman had said that they had thought that they had come down with the flu. The following morning, the couple had received several phone calls from others who were affected at the dinner, followed by a call from a public health official. Dr. Jennifer Russell, the acting chief medical officer of health, said that the public health officials have taken samples of the leftover food from the Christmas supper and are trying to determine the precise cause of the infection. But definitely, the timeline of when those symptoms occurs was within 12 hours. So that's a pretty quick onset. And so that in and of itself would tell us what kind of bacteria we are looking for, Russell said. The most likely one that was discussed with Dr. Yves Brugier, a local public health officer, is Clostridium perfringens. Clostridium perfringens infections are caused by eating contaminated food. Foods that are commonly linked to these bacteria include thick soup, stews, raw meat, poultry, beef, gravies, diced or pre-cooked foods, cooked beans, meat pies. The Public Health Agency of Canada says contaminated food typically needs to have large numbers of bacteria to present to cause a human to have a bad illness. Clostridium perfringens toxins cause abdominal pain and stomach cramps, followed by diarrhea. Nausea is also a common symptom. Fever and vomiting, however, are not normally symptoms of poisoning by Clostridium perfringens toxins. Illness from Clostridium perfringens generally lasts about 24 hours and is rarely fatal. Outbreaks often happen in institutions, including hospitals, cafeteria, prisons, catering firms, school, and long-term care facilities. In these institutions, large amounts of food may be prepared in advance and kept warm at approximately 20 degrees Celsius to 60 degrees Celsius until mealtime. This allows great amounts of bacteria to multiply, according to the Federal Public Health Agency. Anyone can become sick from this bacteria, but seniors, young children, and people with weakened immune systems are at a greater risk of becoming sick. This was a devastating event that shocked our small community. It was simply a Christmas dinner that no one thinks twice about, as they are enjoying their food and company. But it turned out for the worst in this case, in such a small community like Nackwick that I live in. Russell ruled out E. coli poisoning because those who became ill all had symptoms within 24 hours. E. coli symptoms can take 24 hours to show up, but normally take 3 to 4 days, Russell says. Russell said that she does not know when the test results from the samples will be returned to the province. And during this project, I couldn't seem to find the test results either. She said that the information should allow the public and health officials to link the illness to the food that was served. In 2011, the provincial government considered imposing food licensing and inspection requirements on not-for-profit events such as church suppers. But Madeleine Dubé, the health minister at the time, said the provincial government had received public feedback that licensing and inspection requirements are too demanding for not-profit events. Alex Hoffman and his wife thought that they simply had the flu. On Friday, Russell said that the decision to require food inspection requirements on the community events is a government decision and she couldn't comment on the issue. However, she said that the NAFLA death raises the importance of food safety issues. She also said, "I agree that food safety is very, very important. And again today is an opportunity to talk about food safety and prevention, especially coming into the Christmas season when these types of suppers can take place on a pretty regular basis. So really raising people's awareness is now our role." And I agree. We need to raise awareness, especially in small communities where small church suppers are served and there's benefits for people with cancer, for example. It's very important to stop spreading these illnesses. Foodborne illness in Canada. Canada has a very safe food supply. However, foodborne bacteria, parasites, and viruses still cause illnesses in Canada. Every year, about 4 million, 1 in 8 Canadians, are affected by a foodborne illness. Of these, there are about 11,600 hospitalizations and 238 deaths. Back to the point that every year there are about 4 million, or 1 in 8 Canadians affected by foodborne illness. I am one of 8 grandchildren on my father's side. So, for example, that would be like me or one of my cousins having the possibility of getting a foodborne illness. This is ridiculous. This needs to be stopped. But how does this affect us? How is foodborne illness affecting Canadians everywhere? Our estimates on just how much foodborne illness affects Canadians shows that there's still so much work to be done to prevent and control foodborne illness in Canada, focus efforts on the bacteria, parasites, and viruses that cause the biggest problems, and to better understand foodborne illness when there is no known cause. Known and unknown causes of foodborne illness. Foodborne illness, or food poisoning, can be caused by known foodborne bacteria, parasites, and viruses, such as Salmonella, which is found in raw eggs, or norovirus. And there are also other unknown agents, which I will get to in the next slide. Known causes of foodborne illness, however, well, there are at least 30 bacteria, parasites, and viruses known to cause foodborne illness, or food poisoning. These are called pathogens. Many of these pathogens are tracked by the public health surveillance systems that monitor cases of illnesses in Canada. Unknown causes of foodborne illness. There are some. However, in my opinion, it is not important to go into depth of what we don't know, but rather what we do know. We need to focus on what we do know and how to prevent these things. And what we don't know will come in time. And for now, we need to keep doing research and using scientific theories and ideas to come up with ways to prevent this. Monitored in Canada. How does Canada monitor foodborne illness? Well, I wasn't very sure before this project. But now I know that there are surveillance systems across Canada in order to detect outbreaks, monitor trends, identify risk factors, and these systems really rely on information that are provided by local public health authorities and laboratories, provincial and territorial public health ministries and authorities, and Canada uses data from different surveillance systems to estimate foodborne illnesses. Recalls. The public can access recalled products on the Health Canada website. These recalls indicate what dates the food was affected and where, as in what stores, carried this product. A great example of a store that does a great deal with recalls is Costco. When a product is recalled and it was purchased at the store, Costco, The store will personally notify each recipient of the affected product in the most effective and efficient manner. So the public can actually go on the Health Canada website and access these recalls by clicking the recall button, and it will bring up all the foods that have been recently recalled or alerted, and it can tell you all kinds of different things. So they have advisories and recalls all on the same list. But why? Why do we estimate the foodborne illness in Canada? Public health surveillance systems only record a small portion of the total number of foodborne illnesses, which seems crazy. But this is because many people are never really diagnosed with a foodborne illness. But this could be because they either do not seek care and just get better on their own, they do not have a sample tested, such as their stool, urine, or blood. A laboratory test may not identify the bacteria, parasite, or virus that is causing this foodborne illness, also known as an unknown cause. And some illnesses are not reported to the various public health surveillance systems, as well as people might think that they're simply sick with something else, such as a flu or just a bug of any sort. So it is very important to understand the true burden of foodborne illness in Canada. To help to estimate the greater accuracy, we use a set of formulas. However, I'm not going to get into those formulas with this project, as they're pretty complicated to explain. However, it is probably good to know that when you think that you are sick with a foodborne illness, maybe you should report it, and this will help to have better estimates as well. How? How do we estimate foodborne illness in Canada? Well, Canada estimates foodborne illness caused by bacteria, parasites, and viruses, as well as from unknown causes, as mentioned earlier. For recent estimates, we use the year 2000 to the year 2010 data from several nutritional and national, provincial, and territorial public health surveillance systems. Now, I would like to share with you my opinion. Even the incident in Naklik, my hometown, which is super tiny, has helped me to feel more confident in my local food supply. For example, all the small community service groups, like our Lions Club and church members, must participate in a food safety course provided by the Public Health Program in New Brunswick. Beyond that, when you think about going into a local Esso or Irving to buy a sandwich, you can be confident in knowing that their staff has a proper training. I think that my safe food supply is even safer now than ever. So many more people are more careful and understand the importance of the safety of their food. Also, because many successful stores such as Costco, as I mentioned earlier, are so careful of what foods they are selling to the public because they wouldn't want to tarnish their great reputation over an issue that is so very preventable. In conclusion, please watch this YouTube clip about foodborne illness and how it can be prevented and how to protect yourself against it. Thank you for listening to this presentation, and I sure hope that it was educational and will raise awareness about foodborne illness. Thank you.